Hello, Kate Grace, physical therapist, orthopedic physician assistant. Welcome to our live Move Without Limits podcast. So we are live, we don't edit. So if there's boo-boos, oh well. Today we're going to talk about shoulder and elbow pain. They kind of go together and talk a little bit about what it means when your shoulder hurts here, what it means when your elbow hurts here versus here, other causes of shoulder and elbow pain. So here's one, Seymour, and this is your big shoulder joint. This is your scapula or shoulder blade. This is your clavicle. And that's going to become important because we have a special guest today that has an unusual springing of her clavicle at the very unusual spot. So what can happen in your shoulder joint? Well, the first thing, usually when people get pain here, when you do overhead activities or behind you, it's called impingement. And what happens is through this little space right here, the rotator cuff tendons, or 4 rotator cuffs, they hold your shoulder down and it comes through underneath that bone. If your shoulder is raised, if it's internally rotated, if it's forward, then it takes up the space in there and causes an impingement of that tendon. It can start with just an irritation of the tendon. It can grow into tendonitis, it can grow into tendinosis, and it can tear your rotator cuff. So I always say, kill the giant while it's little. So what we're going to do is show you today, if this is you, some great taping techniques to get that shoulder back and down where it's supposed to be. Now, just taping alone is not going to fix it. You need physical therapy, somebody get their hands on you, mobilize your joint, make sure that your shoulder joint, your primary glenohumeral joint, your scapulohumeral joint, your clavicular joint, your scapulothoracic joint are all working together the way they're supposed to be. It's very complex. Your shoulder's made for mobility, not stability. So it can get out of line pretty easily. So we're going to show you some taping techniques, but what you want to do is really work on the position of your shoulder and get it back and down and work on all those muscles in the back of your shoulder where 3 of your 4 rotator cuff muscles are, and I'm going to show you how to do that. So primarily, that's the number one shoulder problem. There are problems with AC joint separations, more rare shoulder dislocations, shoulder laxity, but all those things can be helped with these taping techniques. Most of the time, poor posture is one of the culprits because what we do most of the time is forward. We're forward. We're talking to someone, we're forward. We're working. You can't work on a computer like this. All of our sports are forward. So we have to undo that. So with these exercises I'm going to show you, and get on a foam roller, and the taping should give you a good head start. Elbow pain and anatomy. I don't have a Seymour elbow, but an elbow doesn't have a lot of muscles around it. It's got a couple different bones that bend and rotate and tendons that come off the bone on both the outside and the inside. These are made for mobility as well. You can see there's not a lot of big bulky muscles around the elbow, so it's usually not, well, it's almost never a strength problem. It's when you use the elbow, the little elbow and the little tendons for things you should use the big joints for, the shoulder joint, your torso, your trunk, your core. But if you don't have the strength there or your shoulder's in a bad position, then you overuse your elbow. I'll give you a great example. Years ago, there's a new tennis facility in San Diego, and we had the best juniors in the country at that facility, and half of them had elbow pain. You have these little kids, hitting the ball over and over and over for hours and hours. So they asked me to do this study, examine them, determine the cause of their elbow pain, and then create a rehab protocol to fix it. 100% of those kids who had elbow problems had poorly positioned shoulders. 100%. So these kids their shoulders are forward because what are they doing? They're on their phones. They've got these big backpacks in their arms, but they want to. Now I played tennis in college, so did my guests. So you go back for that big old forehand top spin. You have to have external rotation of your shoulder to do it. You bend down and then you come through. Well, what happens if you can't get your shoulder back there where you need it to be and it's locked in here, but you still want to get that big top spin forehand? What do you do it with? Your elbow. Same with golf, same with pickleball, same with any other sport. You have to do it with your big muscles. So I'm going to show you, we'll talk about the tendons. So the tendons get irritated outside, it's called lateral condylitis, and that's more like tennis elbow. Inside, medial condylitis, golfer's elbow, and it's because of the mechanics of those sports. So when you hit the ball, or when you hit a golf ball, or when you hit a tennis ball. So the tendons they're all bound in a sheath. And so when that tendon becomes inflamed and there's fluid in there, the sheath binds down on the tendon. And then you go to move your arm and it pulls on the tendon because it can't glide through the sheath. And it's highly integrated with nerve endings, so it's very painful. The most painful things, now sports are painful, but the most painful things are small movements. Like my patients say, well, I can't drink my coffee on that side, I can't grip anything, I can't open a jar, I can't open the door. So that's because these little tendons and this joint is made for small movements. So we want to make sure we use our big muscles and big joints for our big movements and not overuse our little ones. So I'm going to show you some exercises now. And as a matter of fact, what you just learned about the tennis kids, in order to fix your elbow, you need to fix your shoulder. And so to do a bunch of exercises with your elbow, it can help, yes, but it shouldn't be the primary focus. I've seen all these videos on all social media, like strengthen your elbow, do these, roll here, take a dumbbell, do this. It's not a strength problem. Like, look, how many muscles do you think I have around my elbow? Not that many. But what you want to do is you want to increase the flexibility of it. And it's complicated because you bend and straighten your elbow, you pronate, you supinate your elbow, and then, of course, there's your wrist. So the main thing, I'm going to show you this first. I don't have a table to stand up, but I'm going to show it to you right here. If you're standing at a table or a countertop or a desk, I want you to take your hand and put it backwards and put it on the table or desk, just like that. So you can probably see that I'm going to stretch this side right here. So it's right here at the desk. And then what you're going to do here is you're going to lean back. So as you lean back, you're stretching this part of your arm. Then what you're going to do is take your palm down flat, and then you're going to lean forward. And then what you're going to do is stretch this part. So people do this, they hold it out there and they do that, and they do that. I don't think it's as good as doing it on a stable surface. So put your hand down and lean back for this side and this way for that side. So do as much as you can in that stretching. I always tell my patients a little bit more often, like don't wait all day and stretch. Don't wait all day and exercise. Like do maybe 10 reps 4 times a day. That would be much better. And so the other thing with your elbow is if it hurts on the outside, then what you want to do is you want to rub, the tendon goes from the top of this bone right here, and it comes down here, and it goes right into this muscle. I used to have a really big tennis muscle right there. I don't anymore. And it goes right into that muscle, and it does this. This is its function. So the tendon runs here where my finger is. So put your fingers on that tendon and rub across it. So you want to loosen up that sheath away from the tendon. If it's on the medial side or golfer's elbow, you do the same thing, and you go like that. Also, I tell patients to take, make an ice cup, put a little Dixie cup in the freezer, bring it out, or use an ice cube, and then take the ice cup and do the same thing. So rub it across the tendon or the tendon, and then do your stretches. So that can get you started. Now, as a physical therapist, we can get our hands on you and really open up that tendon and restore the mobility in your elbow, and then look at you from head to toe to make sure that you don't have to compensate because of posture problems or weaknesses or inflexibilities. So elbow really starts up higher. So make sure when you go to somebody, I'll say this, when you go see somebody, they shouldn't just look at where you hurt. They need to look at you from head to toe. So a good evaluation is looking at your posture, looking at your gait, looking at everything in your musculoskeletal system to make sure that nothing is influencing. These are called predisposing factors. So we want to make sure that you remove all of those. So for your shoulder, let me show you some shoulder exercises. I'm going to start right here on the wall, right here, and then I'll move over with the band. So right here, I want you to put your arm up at about 90 degrees and split your legs apart, and then push back in the wall. It's good for you too. So push into the wall. So you should feel that behind your shoulder. Then, let's assume it's on your right side, then rotate to your left and look like that. And you'll feel, as you rotate to the left, you'll feel you have to push harder to hold your arm up like that. And these do better with prolonged holds versus on-off, on-off. So hold maybe 30 seconds and then come back and then maybe another 30 seconds. So that's on the wall. Now we're going to move over. What I've done over here is I've put some bands into the door jamb. But before I show you that, I want you to make a fist. And I want you to put it into the wall. And you're going to push into the door. Make sure it's shut. And you're going to push real hard into the door. And you're going to feel isometric contraction of your shoulder and your shoulder blade. So you're going to push straight ahead into the wall. And again, hold it for 30 seconds or so. Now what I've done is I've taken a band and I've put it in make sure you put it on the door jamb side of the door because that's tighter than the other side. And you want to do a combination of different exercises with your shoulders. So bend your knees slightly, put your body upright in a good position, start with your palms down, and then rotate your palms in toward your chest, just like that. So we're going to go here. You want to add a little squat to it. That's fine too. So we're pulling right here, and you can hold it right there too. Like squeeze your shoulder blades together. And so then what I'd like you to do is separate those, especially if you have a weaker core on one side. I want you to still be in your athletic stance and do alternate rows. Make sure your band's tight enough. So this is hard to do. We're going to do like 15 or 20 of these. But let's say it's my left arm and it's weaker. I'm going to go 2 here and then 1 here and then 2 there and then 1 there, because you want to always create symmetry and make sure that you make up for one side of which your leg or arm weaker versus the other. Also, your lats are really important because they come all the way up behind your shoulder. So bend over just a little bit, knees bent, back flat. Keep your elbows straight and then pull straight back. Make sure that your hands come back behind your hips here and your back is flat. Don't bend over like this. Bend your knees, sit like you're sitting in your hips, and then pull back just like that. Then I'm going to show you 2 more. And I would, again, do these every day, maybe a couple times a day. I put another band in my door. I put a little knot around this and put it in the doorway. So on this arm, I'll show you internal rotation, then I'll show you external on the other side. So you're going to put the band right up here, right about at your elbow, pull it away from the door, turn away from the door, and then what you're going to do is keep your arm at 90. You're going to feel this in the front because one of your rotator cuff muscles is in the front, and you're going to pull it across and then come back and pull it across. Now we have been focusing on the other side, but you need both. There's a very important rotator cuff muscle under your shoulder blade in the front. So keep it at 90 and pull it across. You're going to feel it right here. And again, stand in a good upright posture. Your abs are not in tight. Now the other arm, I'm going to show you the other way, external rotation, even more important right here. And what you're going to do is keep your arm at 90 and you're going to push out at 90. Now we do this a lot. I'll show you with the other band. We do this a lot down here, but up here, it's a little bit more of a functional position where you're using your arm up here, because you use your arm up here for your sports, right? You don't usually use it down here. Well, you do some in pickleball, I guess, when you go low, but external rotation there. You can also take your band, not in the doorway. This is a great exercise. So you take your band and you wrap it around tight a couple times. We do this in class all the time to get our rotator cuff ready. So I want it nice and tight right here. So when you go like that, it's tight. You tuck your elbows in real tight and you push out. Now, some people do it like this. That's not it. Some people do it like this. That's not it. So you want to make sure that it's how far can you go out? That's the key. How far can you start right here in front, hands in front, and go out? And then if you really want to challenge yourself, stand on one leg and do it like that. Really tighten your core when you do that. Work on your balance. Keep going with your arms. Stand on one leg and do it on the other leg. Do this first to get you started. and then go into the wall, the band in the door, and then the band up high. So those are great exercises for your shoulder. You should do many times a day to get you started. Now, let's talk about taping. So we're going to show you some taping techniques that will help return the shoulder back to where it should be. So there's two kinds of tape we're going to use here. The first one is a white tape, and it's called Stretch Cover-Roll, like that. And it's the reason we use this first is this actually, you can put this on open wounds on the skin. It's white and it's porous, and it's used to protect your skin. So that goes on first. That we pretty much lay it down to use this one. The second one is a brown Leukotape that's really sticky. You know what I mean about live podcast? Leukotape. And what's great about this one is it will hold your shoulder in a good position, but it's really, I mean, this is like duct tape. I mean, it's really thick and sticky. So don't put this on your skin. I have an orthopedic surgeon who was a tennis player, and he asked me to tape his knee before he played tennis. And so I did this with him with the tape. And if you guys want to do knee taping, let me know. Shoot me a comment, and I'll do that another time. And I said, now make sure you put the white tape and then the brown tape. And so the next time I saw him, oh, he goes, that worked great. It was wonderful. And then the next time I saw him, he goes, that tape sucks. Tore my skin apart. And he goes, how could you do that? And I said, well, did you tape yourself? Yeah, well, show me how you did it. You put the brown tape right on the skin. So you always have to check at least once or twice with people to make sure they're doing things the right way. So we're going to invite our guest in now. This is Jack, who's so agreed to come and do this with us. Jack is a great athlete, collegiate tennis player, pickleball player, golfer, and she has an unusual subluxation, sprung sternoclavicular joint. So in your shoulder, you have the clavicles right here and the sterns right here. You have a joint there and ligaments. And then it comes out here, and you have your clavicle and your acromion, the AC joint. Most people bring it here. And I was told they get a big bump, and I was telling my patients, well, that's the end of your bathing suit modeling career. But she did it here. So I don't know if you can see, right there. This is more pronounced on the right than the left. And so when I do this with her, when I push down on it, it feels better because it's where it should be. So how are we going to get that to stay there? And what things what's Jack going to do to fix her challenge? So what we're going to do is there's some skincare here. So before you put your tape on, you want to just take some alcohol, go like this, and you rub it wherever you're going to put the tape. Now she got all cleaned off for us. It's really nice. But we're going to do like her elbow over here. We may do a different taping over here on this shoulder, and we'll maybe do the inside of this elbow on that side. So make sure that you clean your skin up really good before you tape. So the white tape, we're going to go on. You're going to cut. White tape we're going to do first. And the best way for you guys to do it at home is to measure it first on the backside and then cut it. So we're going to start. There are a lot of people that have a lot of tight upper traps. And so we're going to do one that kind of helps relax that down. So you can put some pressure straight down on the upper trap and do that. So we're going to do that first. So I'm going to measure this, and I'm going to go right from the front here and then across her trap. So it doesn't take a lot of tape. So we're going to cut that right there. And it's cut in the middle, so it's kind of easy to use. And we're going to put it right here in the front of her clavicle. We're not correcting her bump yet. And then we're going to just kind of pull it down a little bit and lay it down just in the back. Then we're going to take, thank you, Jack. And then we're going to take the brown tape, and this is very hard to, you can't rip it. This is too hard. And you want to make sure, so this tape is just a little bit narrower than the white tape. So you want to make sure that none of this gets on her skin. You're going to pull on this, so you got to make this a little shorter. So I'm going to measure from here to about there. And I'm going to, I wonder if I can tip these out too.
I still got
it. So what we're going to do is put it right there on the clavicle, and then I'm going to have you come just a little. Thanks, Jack. Now, as I push down on her upper trap, you're feeling this tightness. I'm going to push down on the upper trap, and then I'm going to pull that tape down to mimic where I was pushing. So if you just feel like you're just tense up here and you haven't figured out a way to be your own biofeedback unit and push that down, then that's a good tape job for that. The tape job for Jack's springy is we're going to put it right across the clavicle where it's sprung, and we're going to do a bit of a diagonal pull across. So here's another one. Thank you. So you do need, it takes 4 hands to do this. So you just pull it apart. And again, let me show you how porous this is. It's really porous. So it's you won't hurt your skin. Now I will say this, people with really, really sensitive skin, I put a it's called a skin barrier wipe. I put it on their skin first, lays down like a clear film, and then I put this down. If you do get irritated by the tape, your skin does get used to it, so just give it a chance. I tell my patients to leave this on for 3 days. You can shower, you can pat it dry. If it irritates you at all, you take it off before then. You always take it off after the 3 days in the shower. I think that's easiest. And then let your skin heal overnight while you sleep, and then you can put it back on. But again, it's meant to assist with exercises and physical therapy. So we're going to lay this down right over where Jack's bump is, because what we're going to do is we're going to push that down, and we're going to bring it a bit of a diagonal back there. So then I'm going to measure this here, just short of where I want it to go, so I don't touch her skin. Again. Yeah, all right. So this is the one you make the correction with. You're going to go right on top of that springy ligament. So ligaments, when they stretch out, like in your ankle, they don't go back. They're not like rubber bands. So once you spring something, the only thing that'll help her, this may never go down, but she has pain here, she has pain into her shoulder, she has pain going back into her shoulder blade. The things that are going to help that is the taping and working on all the strengthening to keep her back and down so she can't go forward. And I think oftentimes this can happen from a fall, getting hit in like football, but it can also happen with repetitive movements. And since she's played so much tennis and golf and pickleball, and it's all forward, then I think that's probably over time her stretched out. So unless you've been playing football, I don't know about
rugby.
So you're going to push down on this. Now, if you're sprung here or if you're sprung here, it's the same thing. You're going to push down on the clavicle or collarbone. You're going to push it down. Sorry, John. Usually I keep sitting, but you can, yeah. And then you're going to push it down, and then you're going to pull it back, just like that.
And it's a significant amount of pushing.
Yeah.
Like I had to stabilize.
Yeah, and if you want, I usually have my patients sit down, so this isn't as hard, but Jack's got a good core. All right, so then on this side, I'm going to show you a relocation tape. So your shoulder, if your shoulder's forward, what we want to do is pull it back like that. And so we're going to take the piece of tape. Yeah, no, relax. And we're going to take it right from the front of the joint, and you're going to come, and I'll show you this around the back when we're done. You're going to come all the way around the back, down to the tip of her shoulder blade. And, this is really good because we haven't done this. We haven't practiced this. This is very good. Fantastic. Okay, so I'll need you to put your right arm down, okay, and just relax it. And so we're going to go right from here. So I'm going to take this from a forward and internally rotated position, and we want to take it back down to the scapula. So if you want to turn around and just show them, like, this is where, perfect check, this is where it needs to go right there. Okay, go back, and then I'm going to make sure, and I'll show you how this is going to probably feel the most movement for you, Jack. It's good, but it's so arm has to be relaxed. This is where you're going to really have to hold. And the thing is, you have to hold with your, you can't hold with your shoulder because then it won't stay. So what I'm going to do is I'm going to take my thumb right here and I'm going to push her shoulder back. See if you can just relax a little more. Yeah, good job. And your skin and the tape should pucker as you do it, if you're doing it right. And then, we got it just right at the back side. So it's like that. So
Really good.
yeah, so here, see, that's where that goes. Okay, then we'll do one more. I think we can, unless this bothers you, I think we can do this on the same side. Then we don't have to. So what I'm going to do is one, if you have an impingement, rotator cuff tendonitis is a good technique. But also, if you have that, I will do this one as well. And then what we're going to do is in this position, I'm going to take the tape right from here in the front. And I'm going to bring it across a little bit more of a diagonal. I feel like a perfect patient, I tell you.
Follow direction walk.
I bet your report card said, follow directions, well, plays well with others. Okay, so now we have to do, and if you are have them sitting, just have them rest their arm on something. And so what we're going to do is take this from here in the front, and then this diagonal is going to be a little bit more of a diagonal to pull back that way. So if you want it to turn around, you can, that comes back that way more, okay? And then we are going to move this one also as we do it. So we're going to go here, measure twice, cut once. I didn't learn that in sewing, I learned that in surgery. It's maybe a little more important. All right.
So don't need to have my arm for this.
Yes.
Okay.
So I want you to rest it on me. Okay. And then what you're going to do here is you're going to, in the front of your shoulder, you're going to push back, and you're going to roll it back like that. And put it down. So that's a lot of tape on one shoulder, but you should feel like you're way back. I know. It's like, all right, now.
Back to the bodybuilding.
Right. So for your elbow, what you want to do for your elbow is you want to your tendon goes right here. You want to unload it. So what we're going to do is put a couple pieces of tape here, lift up on that tendon and lay it down. So that's, I'm going to lower this just a little because, good job, Kate. So you don't have to, from here. I'm going to, let me think, go one here, one here. So just a little one right here. Great. I think that's from this.
There.
So we're going to do one down here. Again, I would have my patient sit instead of standing. So I'm going to put it in here. I'm going to leave that flap open. I'm going to take another one that's going to be a little longer here. For your left hand, are you left-handed?
No.
Oh,
but
you're using your
holding
left
and
hand.
stuff
Okay.
together.
Thank you.
Gonna be a crap job, but that's great.
So this one is going to go back here. Right there. And you lay that down. Then we're going to take the brown tape. Okay, thank you. And we're going to do the same thing. So what we are going to do here is we're going to go like this. And we're going to lift up on the tendon. Put those together. Yeah. No. So, yeah, this is a good one. I don't think this is, I don't know, anywhere, but I seem to help my patients when I do. So here we are here.
There we go.
There. So my producer's not saying anything. I don't even know we don't know if we're in the picture. Right. So again, Jack would be, down, lower.
Well, being 5'1", I can't get much lower.
All right. So what we're going to do here is pick up her skin, lift it, and then pull it down. So there's a lot of different ways to do that. We'll come over here, let them see. So then you would do the same thing on the inside as you do on the outside, the exact same thing. So it's no different. So those are the primary. So a couple other things about tape. You can relax, Jack. A couple other things about taping is just you have to watch for skin challenges. Make sure you take care of it. If you have the opposite problem of light skin, you have like oily skin. Besides alcohol, you need to clean it really good with soap and water and alcohol. You can also use what do you call the thing for hemorrhoids?
Preparation
H on it. You can do that if you have irritation to your skin. That heals it as well. You can use milk of magnesia, that or baby powder, that dries your skin out. So if you have, I've had athletes who say, yeah, I love that, but I sweat so much when I run, it comes off. So I've had them do those kind of things, and then that's helpful. So besides seeing a good PT, exercises, taping, those should solve the majority of your shoulder problems, and they don't usually require surgery, not usually. So if you have a frank tear in your rotator cuff or in one of the tendons of your elbows, I would highly recommend getting a PRP injection before you consider surgery, because the growth factor cells in the PRP will go, when you do it with the right person, if you haven't seen a regenerative medicine podcast, please go back and look at Dr. Chris Rogers, who's one of the best in the world, and that it's done, diagnosis is correct, it's done under guided ultrasound to know exactly where it's going, has done tons of studies with the FDA. You can actually grow your stem cells in their labs. You can have them for various things. But I've had a lot of patients say, well, Kate, I've done all those things. I've done all that with my elbow. I've done what you said, had therapy, I've done this. Well, if you do have a frank tear, then the best treatment is to get a PRP injection and do physical therapy. So that combination works really great. So if you have questions about shoulder or elbow, thank you, Jack, for being such a good, you asked me this question, so we're going to talk about it now before I do crazy things I see at the gym, and AKA about sleeping positions. Yes. Jack asked, so that's a great question, and I tell all my patients, the main thing you want to do is keep your shoulder in neutral. And so if you go and lay on your side to sleep, and your shoulder has to roll forward, so you have to put a pillow underneath that top arm. You should always have a pillow between your knees. Same thing, your knees are narrower than your pelvis. So if you don't put a pillow between your knees and they touch on your side, then you're going to pull on your hip, SI joint in your back all night. Same with your shoulder, because what we just showed you with her. What do we want to avoid? That shoulder rolling in. Well, it rolls in when you lay on your side. So you got to lay down with a pillow right here under your arm, so it's in neutral, because this on my side is no different than this. That's what you want to reproduce. So thank you for asking that question. All right, questions we'll take next segment. Thank you, Jack. Crazy things I saw at the gym this week. Now, I did not want to take a video of the person doing it, so I reproduced it for you. So it's about the elliptical. When you do the elliptical, you do not bend forward. Holding on for dear life and bending over and doing it as fast as they could on their toes. Here's a right way to do it. Stand up. Again, little muscles, your Achilles tendon, your ankles push down from your hip. And that is elliptical, Stairmaster, even on the treadmill, just really use good form. So now our second favorite segment, AKA Ask Kate Anything. So I'll have to ask our producer if she has any questions for us from the audience. I know we answered a whole bunch. I meant to wait till we're done, but I couldn't help it. Jack reminded me of some questions. So
Can elbow pain come from my shoulder or neck?
good question. Can elbow pain come from my shoulder, neck? Yes, is the answer. If you have sleeping at night and your arm goes numb, it's probably coming from your neck. So here's where you want to look at pillows. I just had this, someone asked me this in a telemedicine appointment last week. She said, well, I use this really firm, big pillow, and she's small like Jack. And when you lay down, you're only trying to take up the space that between your head and your shoulders. It's like this big. So a small pillow, you can take a towel, roll it and put it in your pillowcase to put a towel roll there, so it's there whether you go on your side or your back. But don't use a great big pillow that pushes you forward. Another patient told me that they crank their bed up at night, so they're sleeping an incline up, and their neck hurts and their arm goes to sleep. So well, that's why. So what happens is the nerve where it comes out of the hole from your spinal cord gets impinged by poor neck position. So that can come from your arm, and it follows a distribution. So if it's C5-6, it's going to go into your shoulder, C6-7 this side, C7, T1 down this side. So it can, it will follow a specific distribution and pattern. If you get numbness, tingling, weakness, number one, weakness. If you can't do this, if you can't do this, if you can't do this, seek help from a really good medical professional. But it can come from up here. That's why we have to look at everything.
Marty would like to know, can I lift weights with elbow pain?
I bet I know who this Marty is. Can I lift, I bet this is big Marty. Can I lift weights with elbow pain? Yes, but here's a couple things I would check. Because it's kind of like in golf. People don't do this. They just grip those dumbbells and those bars till they're white knuckled. So you have to do a really, really loose grip. Also, a loose grip on your golf club will help. And here's the primary thing: do not reproduce the pain. Like if it doesn't hurt to do this stair bend, great. But if it hurts to do a press overhead, don't do it. Find other things you can do in the gym that don't hurt it. So don't reproduce the pain, because it's like you're ripping the Band-Aid off every time you do it. You're making it worse. You're irritating the tissue. You're irritating the delaying healing. So things that don't hurt. And if it hurts your elbow, then Marty, do more legs, for guys. Do more core. Don't do so much upper body.
I have one more here. Patty wants to know, I've done many of these things, but why won't my elbow pain go away?
So I've done all these things, but my elbow pain doesn't go away. So I think you're one of those people that need a PRP injection. Because I've had a lot of patients who, we start conservatively. You can take orally anti-inflammatories to decrease inflammation in the sheath and the tendon, do physical therapy. But I've had patients say, well, I'm 75% better. Well, we want to be 100% better. So then we go and talk about a regenerative medicine injection. So that, along with PT, would be good. But I think if it's going on for a long time and you can't return to the activities that you want to do, then it's time to seek another level of treatment. And speaking of that, don't let something go like more than a week. Like if it bothers you and you're like, okay, I'll ice it. What you do for acute injuries, it's chronic, I'll put some heat on it. I'll rest. I'll avoid the activities that bother. Like if I tried to tell Jack not to play pickleball, it would be like talking to that door over there. It wouldn't work. So she may need an additional type of treatment, but she came in and showed me this right away. So when you get treatment right away, you'll get better faster. So we had a couple of our friends who had young kids who let an injury go too long and end up being catastrophic. So please don't wait. Don't wait for it to go away. And also, usually when you have a musculoskeletal injury, your pain doesn't just go away on its own. And if you just rest, it doesn't just go away. If you rest and for a couple of weeks and you go back and do your activity, it'll probably come back. because you didn't do anything to change the musculoskeletal system. You didn't do anything to change your position or your strength or your flexibility. So make sure you do that. Thank you, everybody, for joining us live. This was quite the experiment. If you want to see more taping techniques or exercises or things that can help you with your orthopedic problems, just shoot us a comment, let us know. We'd be happy to cover it for you. So we'll be back next week with an all-new Move Without Limits podcast. Thanks again. Before you head out, I'd love your help. When you like, when you share, when you subscribe, it's not just a click, it's a gift. Every tap helps this message reach someone who may be sitting in pain, wondering if they'll ever move without limits again. So go ahead, hit that button now, and let's keep moving together.